Welcome to the Arkansas Health and Wellness Cultural Competency for Providers presentation. The purpose of this training is to provide a comprehensive overview of cultural competency as it relates to our members and our contractual requirements as a health plan. This is an annual training offered to every provider. Today, our objectives are to define cultural competency, describe the potential benefits of culturally competent care, underline the legal and ethical necessity of cultural competency, consider how culture might interact with healthcare, identify groups who experience health disparities, and practically improve your cultural competence. Cultural competency is defined as the ability to work with and for diverse cultures. This involves responding respectfully and effectively to people of all cultures in a manner that affirms the worth and preserves the dignity of individuals, families, and communities. But why is culturally competent care important? Let's consider the 5 potential benefits of culturally competent care depicted with these icons. Culturally competent care can improve diagnostic accuracy. Culturally competent care can increase adherence to recommended treatments. Culturally competent care can reduce emergency room use. Culturally competent care can reduce health disparities. We will discuss health disparities later in this presentation. And finally, culturally competent care can reduce overall costs for providers. The legal background for culturally competent care is extensive. Title II of the Americans with Disabilities Act prohibits excluding or denying benefits based on an individual's disability. The definition of disability is broad and includes HIV status. Title VI of the Civil Rights Act of 1964 take reasonable steps to provide meaningful access for limited English proficiency or LEP patients. The Age Discrimination Act of 1975 prohibits discrimination on the basis of federal financial assistance. Entities receiving federal funding cannot discriminate on the basis of age in their programs and activities. Title IX of the Education Amendments of 1972 prohibits discrimination on the basis of sex in education programs and activities. Section 504 of the Rehabilitation Act of 1973 states that individuals with disabilities may not be denied or excluded from benefits and services from some programs. This is applied to entities that receive services from federal departments or agencies. Section 1557 of the Affordable Care Act prohibits discrimination in federally assisted and some federally conducted health programs and activities administered by entities created under Title I of the Affordable Care Act. Federal health care provider conscience protection statutes prohibits discrimination on the basis of religious or moral objections. Let's check your knowledge on the information presented. Which of the following are potential benefits of cultural competency? Better adherence to treatments. B. Higher costs. C. More accurate diagnoses. Or D. Both A and C. Option D is correct. Potential benefits of culturally competent care are better adherence to treatments and more accurate diagnoses. Which of the following laws states that reasonable steps should be taken to provide access to services for patients with limited English proficiency? A. Age Discrimination Act. B. Civil Rights Act. Or C. Americans with Disabilities Act. Option B is correct. The Civil Rights Act addresses access to services for patients with limited English proficiency. Now that we understand why culturally competent care is important, let us discuss how you might notice culture interacting with healthcare. You might see a patient's culture interacting with their health and well-being in many ways. These can include how someone thinks about their health, how someone practices taking care of themselves, as well as how someone speaks or discusses their health care. You might observe that how people think about their health can vary tremendously. This can include concepts about how mind, body, and spirit are integrated. Natural elements might be preferred to other medicinal options. Links to community might be discussed during discussions of both causes and treatments. And how patients expect to see outcomes of treatment. This might be how quickly results are expected or how they are noticed in the body. You might notice that how people expect to treat their health might differ as well. This can include wanting to discuss herbal treatments and their uses, expectations around authoritative health figures that need to be consulted, discussing religious or spiritual elements of treatment, as well as expectations around modifying behaviors as a treatment option. Finally, and perhaps most noticeably, your conversations with patients might differ. You might hear other languages spoken, that expectations differ around asking and answering questions, and that there are significant nonverbal communication differences. Take a moment to think about how your patients have differed in these areas. What changes did you make as a provider to make sure you were communicating well? It is important to note that cultural differences can lead to health disparities or preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal health. Some communities and individuals are at a greater risk of health disparities, including individuals with disabilities, individuals with low income, individuals within ethnic or racial minorities, individuals within indigenous communities, individuals who are non-English speaking, individuals with low health literacy, and individuals who identify as LGBTQ+. Members from these communities experience systemic discrimination. It is our responsibility to increase awareness and intentionally create better treatment outcomes for these individuals. Individuals might also experience what is called low health literacy. Health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. Patients with low health literacy may have difficulty locating providers and services, filling out complex health forms, sharing their medical history with providers, and they may also have challenges seeking preventative health care, knowing the connection between risky behaviors and health, managing chronic health conditions, and understanding directions on medicine. Low health literacy is different than, but may include individuals with limited English proficiency or LEP. Limited English proficiency is defined as a limited ability to read, write, speak, or understand English. Generally, an individual with limited English proficiency does not speak English as a primary language. This category might also include those with hearing, language, or other disabilities who may require interpretive services or language assistive technology. Did you know that Arkansas Health and Wellness provides the services of a language translator that can assist during clinic visits? Sign language interpreters are also available. If you need translation services, please contact one of the numbers displayed here. Let's check your knowledge on the information presented. Which of the following might a person with low health literacy find difficult? A. Finding your location. B. Answering questions about symptoms. C. Filling out forms about previous medical conditions. Or D. All of the above. If you decided on option D, you are correct. All of the above might be difficult for someone with low health literacy. Remember, low health literacy indicates that individuals have difficulty obtaining, processing, and understanding basic health information and services. As we've seen, learning about other cultures and bridging the gaps for those with health disparities is part of your daily work. Becoming a culturally competent provider will be a journey filled with learning opportunities and new experiences. So, where should your journey begin? Most experts agree it starts with you. We know that the most culturally competent providers are aware of their own biases as well as their personal and cultural history. Become an expert in active listening. Active listeners ask open ended questions. They continue to clarify what they are hearing, repeating or summarizing the conversation frequently, empathizing by including the emotions behind what they are hearing, and taking time to speak clearly. One practical way of using active listening in a healthcare setting is to adopt the teach back technique, which asks patients to state in their own words what they need to know or do about their health. Make sure you are intentionally creating a safe space for your patients to disclose important information. Ask for introductions and use the names and pronouns mentioned to refer to individuals present. Ensure confidentiality, both in physical space considerations and in how private health information is discussed. Use individual first and gender neutral language as much as possible. And remember, do not make assumptions. Make sure you create, post, and attach a non discrimination policy to patient materials. You will also need to maintain an anonymous and accessible complaint policy and respond quickly to any complaints you receive. Accommodations should be available, such as auxiliary aids, translated materials, help with filling out forms, universal symbols on signs, and a resource list of other social services in the community. Consider the languages and diverse populations present in your surrounding community. How can you represent those populations in your advertisements, your communications, and your hiring practices? Please note that providers have a legal obligation to conform to ADA requirements as noted in their contract with Arkansas Health and Wellness and Arkansas Total Care. Create adequate space within waiting rooms and exam rooms. Have medical equipment that accommodates individuals with disabilities. Ensure your office is accessible with ramps and adequate parking with proper signage. Provide exam room and waiting room furniture that can accommodate individuals with physical and non-physical disabilities. Let's review the ways you can continue your journey towards greater cultural competency. 1. Develop self-awareness. 2. Become an active listener. 3. Promote safety in your communication. 4. Create and distribute relevant policies. 5. Make reasonable accommodations. 6. Demonstrate your commitment to diversity. And 7. Ensure access for individuals with disabilities. What practical aspects of these steps have you thought of during our presentation? How can you take the next step in your journey? Please note that Arkansas Health and Wellness, Arkansas Total Care, provides an electronic survey which consists of 65 questions asking providers to self-attest in 4 main areas of disability access. Area 1, parking. 2, exterior building. 3, interior building. And 4, programmatic access. Your responses will determine what members initially see in their provider directory. You can access the Provider Accessibility Initiative Survey on the Provider Portal. Questions concerning the Provider Accessibility Initiative Survey can be submitted to arkcredentialing@centene.com. If you have completed watching this course, please make sure you attest to taking cultural competency training on the Provider Portal located under Provider Resources. If you have questions concerning today's session, please submit to providers@arhealthwellness.com. In the subject line, refer to Cultural Competency Training. Thank you for watching and listening to this presentation.